Welcome to the Deep Dive. Today, we're diving into the Deloitte Insights Report.
2025 U.S. Healthcare Outlook.
You got it. So if you're prepping for a meeting or just curious about what's next in healthcare, this is for you. We're going to give you those essential insights without,
Right.
drowning in the details.
It's like a cheat sheet
Exactly.
for the future of healthcare.
And the first thing that jumped out at me
Okay.
was the optimism. Almost 60% of healthcare surveyed have a positive outlook for 2025.
Okay.
And that's a pretty big jump from last year's 52%.
That's a pretty significant increase.
It is.
What's interesting is it's not just
Yeah.
blind optimism, right? 69% of those execs
Yeah.
predict revenue growth, and 71% expect improved profitability.
Yeah, that's a good sign.
So there's a sense that, after a couple of tough years, the industry is finding its footing.
Finding its footing for
Yeah.
sure. But here's where it gets interesting.
Okay.
The report also highlights two kind of conflicting priorities for 2025.
Yeah.
Growth strategies
Okay.
and consumer affordability.
Got it.
So 65% of the execs are focused on growth strategies.
Okay.
But 46% are prioritizing making things more affordable.
Interesting.
So the question is,
Yeah. How do
they plan to grow revenue
Yeah.
while making healthcare more affordable?
That is the question, isn't it?
It is the million-dollar question.
The million-dollar question, and the report suggests a multi-pronged approach,
Great.
starting with a strong emphasis on organic growth rather than
Okay.
mergers and acquisitions.
So they're looking to build from within.
Yeah.
What does that actually look like?
Well, both health plan and health system execs agree that improving the consumer experience is key.
Interesting.
It's almost like healthcare is finally catching up to other industries like
Right.
retail or hospitality.
Yeah, where customer experience is paramount.
Exactly.
So are we going to start seeing loyalty programs and frequent flyer miles?
Maybe not that extreme, but the report suggests several specific growth strategies focused on the consumer. One is tailoring products and services to meet the needs of specific markets.
Okay.
It's about understanding different consumer segments and creating offerings that cater to those
Yeah, that makes sense.
specific wants and needs.
Yeah, a one-size-fits-all approach to healthcare doesn't really work
Not at all.
when you have so many diverse needs and preferences.
Exactly. Another key strategy is addressing the top reasons people skip care or delay care: cost and access barriers.
Yes.
It's about making healthcare more convenient and affordable.
Yeah, I've definitely been guilty of putting off a doctor's appointment
Right.
because of cost or the hassle of getting there.
And you're not alone. A lot of people make those same choices,
Yeah.
which ultimately leads to worse health outcomes and higher costs down the line.
So it's in everybody's best interest to make
Right.
it more accessible.
Absolutely.
What else are they doing to kind of attract and retain consumers?
They're also focusing on rebuilding trust. The report acknowledges that, negative experiences have eroded consumer confidence in the healthcare system. And even with new technology like generative AI,
Yeah.
people are demanding transparency and control over their health data.
Makes sense.
It's not just about offering the latest tech, it's about building trust and ensuring that
Right.
consumers feel comfortable using it.
Yeah, they need to feel confident that their data is
Exactly.
safe and being used responsibly.
Absolutely.
So where does technology fit into all this?
It's a huge piece of the puzzle. About a third of healthcare executives identified technology investments
Okay.
as a top priority for 2025.
Wow.
This includes everything from patient portals and apps to remote monitoring and virtual visits.
It seems like the pandemic really accelerated the adoption of all these digital tools.
For sure.
And it doesn't look like that trend is slowing down at all.
Absolutely right. And with increased digitization
Yeah.
comes a heightened focus on cybersecurity. 60% of health systems and 50% of health plans say they're prioritizing cybersecurity in 2025.
Wow.
It's not just about mitigating risk, it's also about maintaining trust, ensuring financial stability.
It's like the foundation
Exactly.
upon which all these other strategies are built.
You got it.
If everyone is focused on adopting the latest and greatest technology,
All right.
how do we ensure that everyone benefits from these advancements?
That's a great point, and the report highlights prioritizing health equity as a crucial growth strategy.
Okay.
But surprisingly, only 23% of executives identified it as a top priority.
Really?
It might seem counterintuitive,
Yeah.
but by developing products and services tailored to diverse populations, healthcare organizations can tap into new markets and address unmet needs.
So they can actually increase revenue by focusing on those who have been underserved.
Precisely.
by the healthcare system.
One way they plan to do this is by utilizing community health needs assessments,
Okay.
which gather data on health status and gaps in local communities.
Gotcha.
These assessments can help organizations design targeted services.
So it's about going beyond that one-size-fits-all approach and really understanding the unique needs
You got it.
of different communities.
Absolutely.
We've talked a lot about growth strategies.
All right.
But how do healthcare execs plan to tackle the affordability crisis?
Well, they acknowledge that affordability is a major concern and not just for consumers.
Right.
Since 2020, out-of-pocket costs have risen faster than overall healthcare spending.
Oh, wow.
This has real consequences,
Yeah.
forcing people to skip essential care, leading to worse health outcomes,
Yeah.
and ultimately driving costs even higher.
It's a vicious cycle.
It is a vicious cycle.
That's a scary thought. If people can't afford basic care, it's only going to create bigger problems down the road.
Exactly. So to address this,
Okay.
the report outlines several strategies.
All right.
One is developing inclusive products and services that cater to diverse needs, ensuring affordability and access,
Got it.
regardless of demographics.
It sounds like they're taking a page from other industries where you have different tiers of service.
That's a good analogy. Another key strategy is
Okay.
expanding access.
Okay.
This includes investing in alternative care sites, extending clinic hours,
Oh.
and offering more virtual health options.
That's where those digital platforms we talked about come into play.
exactly.
Virtual visits, for example,
Right.
can be more convenient and potentially less expensive than traditional in-person appointments.
Absolutely. And the report notes that consumer demand for virtual care is on the rise.
Yes.
64% of consumers find virtual visits more convenient
Interesting.
than traditional appointments.
So convenience and cost effectiveness are key.
Yes.
What else is on the table?
Well, they're also looking at investing in consumer-facing digital technologies,
Okay.
like connected monitoring devices and health apps.
Those can be great tools for empowering patients and giving them more control
Absolutely.
over their health information.
And that can lead to more informed decision-making and potentially lower costs.
Right.
For example, imagine a diabetic patient
Okay.
using a continuous glucose monitor that automatically adjusts insulin dosage,
Yep.
preventing dangerous highs and lows.
Right.
That level of personalized proactive care can significantly reduce
Wow.
the need for costly emergency interventions.
That's a great example. But even with all these great ideas, technology alone can't solve the affordability issue.
Absolutely not. And that's why
Okay.
they're also looking to partner with employers
Okay.
who play a huge role in healthcare coverage.
Right.
Remember, employer-sponsored health insurance covers around 154 million Americans.
That's a significant chunk of the population.
Exactly. So health plans and systems are looking to work more closely with employers to promote healthier lifestyles,
Okay.
offer wellness programs,
Makes sense.
and ultimately reduce costs for everyone.
Healthy employees mean lower healthcare costs for everyone involved.
Absolutely. And finally, to round out these strategies, the report emphasizes the importance of enhancing operational efficiency.
So it's about healthcare organizations finding ways to do more with less
Exactly.
and reduce waste.
Exactly.
So getting their own house in order
You got it.
before asking consumers to bear the brunt of cost-cutting measures.
Exactly. This includes strategies like outsourcing non-core capabilities,
Okay.
adopting more efficient staffing models, and investing in automation and AI for tasks like administrative work.
Okay.
They're even looking at taking advantage of financial incentives related to decarbonization efforts.
Wow.
It's about finding every opportunity to streamline operations and reduce costs.
Okay, we've covered a lot of ground here.
We have.
Growth strategies, the push for affordability,
Right.
the increasing role of technology.
Yeah.
But there's another big piece of the puzzle that we haven't touched on yet.
Okay.
The political landscape.
Ah, yes. The elephant in the room.
The return of Donald Trump to the White House in 2024 has injected a dose of uncertainty
Yeah.
into the future of health.
A lot of unknowns.
44% of healthcare executives believe regulatory uncertainty will shape their 2025 strategies.
Wow.
So we are entering a new era, and nobody's quite sure what to expect.
A lot of question marks.
So how do these potential political shifts impact the healthcare landscape? What should our listeners be prepared for?
Well, that's precisely what we'll be unpacking in the next part of our deep dive.
Stay tuned.
Stay tuned.
Welcome back to the Deep Dive. Before the break, we were talking about all the exciting opportunities and challenges facing the healthcare industry in 2025.
Right.
But things got a little cliffhangery when we mentioned the political landscape.
Right. The 2024 election and Trump's return to the White House have definitely added a layer of complexity.
For sure.
The Deloitte report highlights a few key areas where we might see significant shifts.
Okay, so let's unpack those. What are some of the biggest question marks hanging over the healthcare industry right now?
Well, first and foremost, the future of the Affordable Care Act is uncertain,
Okay.
particularly with those enhanced premium assistance tax credits set to expire.
Yeah, that could have a huge impact on millions of Americans
Right.
who rely on those subsidies to afford health insurance.
Absolutely. We're also likely to see a renewed focus on protecting Medicare,
Okay.
which is a major concern for a large portion of the population, especially with the aging baby boomer generation.
So those are two big ticket items.
Right.
What else is on the radar?
The report also points to a strong emphasis on addressing high drug costs.
Okay.
This has been a hot-button issue for years, and it's likely to remain a top priority for the new administration.
Yeah, it feels like every time I go to the pharmacy, I'm shocked by the price of my prescriptions.
And you're not alone. It's a major pain point for consumers and a significant driver of overall healthcare costs.
So it sounds like we can expect to see some action on that front. What other policy shifts are they anticipating?
Well, there's a lot of talk about tackling surprise billing,
Okay.
which is that awful situation where you get hit with an unexpected medical bill
Right.
after receiving care from an out-of-network provider.
Yeah, I've heard horror stories about those surprise bills. People end up facing thousands of dollars
Oh, yeah.
in unexpected medical expenses.
Exactly. And it's something that lawmakers on both sides of the aisle seem eager to address.
So that's a potential win for consumers. What else is on the agenda?
The report also mentions a focus on increasing price transparency in healthcare.
Okay.
The idea is that if consumers have a clearer understanding of the cost of care up front,
Right.
they'll be able to make more informed decisions about their treatment
Well, it
options.
seems like price transparency is becoming more important across all industries.
It is.
Consumers want to know what they're paying for before they commit.
And rightfully so, healthcare is no different.
So we've got potential changes to the ACA, a focus on protecting Medicare and lowering drug costs,
Right.
plus initiatives to tackle surprise billing and increase price transparency.
Yeah.
Anything else we should have on our radar?
The report also points to the possibility of changes to tax rules and government spending through budget reconciliation. It's a bit of a wild card, but it could have ripple effects across the entire healthcare industry.
So a lot of potential changes on the horizon.
Yeah.
It sounds like healthcare organizations are going to have to be very adaptable and strategic to navigate this evolving landscape.
Exactly. They need to stay informed, anticipate changes, and be prepared to adjust their strategies as needed.
It's a lot to keep track of, but it's not all doom and gloom, right? The report still highlights a lot of opportunities for growth and innovation.
Absolutely. Remember, despite the uncertainty, there's a prevailing sense of optimism.
Okay.
Among healthcare leaders, they see a path forward and they're excited about the possibilities.
That's reassuring.
Hmm.
So let's dive into some of the specific recommendations for health plans and health systems as they navigate this new era.
Okay, well, for health plans, one of the most important things they can do is closely monitor presidential appointees
Okay.
within key agencies like the Department of Health and Human Services and the Centers for Medicare and Medicaid Services.
So it's about paying attention to who's calling the shots and anticipating how those individuals might shape future policy decisions.
Exactly. They also need to keep a close eye on the balance of power in Congress, as shifts in control could significantly impact healthcare legislation.
It's like a political chess game
Yeah.
where you have to anticipate your opponent's next move.
Precisely. And finally, they need to strengthen their regulatory strategies.
Okay.
This means being prepared for potential changes at all levels of government, federal, state, and local.
It sounds like a tall order, but it's essential for survival in this ever-changing environment.
Absolutely. Now, on the other side of the equation, health systems are facing their own unique set of challenges and opportunities.
Right.
Remember, we talked about how they're focusing on strengthening their core business technologies and grappling with workforce issues.
Right. Those are two big buckets. So what specific advice does the report offer to help health systems navigate these challenges?
Well, on the technology front, they really need to prioritize modernizing their systems. This means investing in those core technologies that we discussed earlier, like electronic health records, enterprise resource planning systems, and customer relationship management tools.
It's about making sure those foundational systems are robust, integrated, and able to support the demands of a rapidly evolving healthcare landscape.
Exactly. They also need to think about adopting a cloud environment to enhance storage security and scalability.
Yeah, it seems like the cloud is becoming the go-to solution for all sorts of industries, offering greater flexibility and accessibility.
And healthcare is no exception. The cloud can really empower health systems to leverage data more effectively, streamline operations, and ultimately provide better care.
So we've got health plans focused on navigating the regulatory landscape and health systems prioritizing technology modernization.
Right.
What about those workforce challenges? That seems to be a major concern for health systems in 2025.
Absolutely. The report really emphasizes the need to go beyond traditional solutions and find innovative ways to address clinician burnout, talent shortages, and rising labor costs.
It's a complex issue with no easy answers. So what are some of the more outside-the-box solutions they're proposing?
Well, one interesting idea is to establish command centers within health systems.
Command centers.
Right.
It sounds a bit like something out of a sci-fi movie.
It might sound futuristic, but these command centers are actually centralized governance and operations structures
Okay.
that can help drive efficiency and coordination across the entire health system.
So it's like having a central nervous system for the organization, coordinating all the different parts and ensuring they're working together smoothly.
Exactly. It's about breaking down silos, streamlining communication, and ultimately making the most of limited resources.
That makes a lot of sense, especially in a time of workforce shortages.
Right. It's about working smarter, not harder.
Yeah.
And speaking of working smarter, the report also highlights the need to invest in technologies that can help alleviate some of the burden on clinicians.
Things like AI and automation that can take over administrative tasks and free up more time for patient care.
Exactly. They also suggest exploring new work models like virtual nursing, which can provide more flexibility and potentially reduce burnout.
It sounds like they're really looking to think outside the box and find creative solutions to these workforce challenges.
They have to, the status quo isn't sustainable, so it's about finding innovative ways to attract and retain talent, improve working conditions, and ultimately create a more sustainable healthcare system.
Now, all of these recommendations for health plans and health systems sound great. But I can't help but wonder, how do they plan to address the growing concern over AI in healthcare? We talked earlier about consumers' mixed feelings about AI and the need for transparency and trust.
Right.
How do these recommendations fit into that larger conversation?
That's a great point, and it's something we'll be diving into in the next segment.
Stay tuned.
Stay tuned.
Welcome back to the Deep Dive. We've been exploring this idea of a healthcare system that's both innovative and affordable.
Right.
And now it's time to address the AI elephant in the room.
Yeah, it's not enough to just say AI is the future of healthcare, you know?
We need to think critically about how it's implemented,
Yeah.
especially when it comes to sensitive health data and the potential for unintended consequences.
Right. Earlier we talked about consumer concerns about AI,
Yeah.
the creep factor,
Yeah.
the fear of data breaches, the feeling of being treated like a data point rather than a person.
Yeah.
So how can healthcare organizations address these valid concerns?
Well, the Deloitte report actually offers some
Yeah.
concrete recommendations for health plans specifically,
Okay.
since they seem to be the most eager to adopt AI.
Okay, let's hear them. What can health plans do to ensure that AI is used responsibly and ethically?
First and foremost, they need to strengthen governance
Okay.
around AI implementation. This means creating clear structures and processes to manage AI development and deployment,
Got it.
ensuring that it aligns with the organization's values and ethical principles.
So not just throwing AI at every problem, but really thinking through
Really.
the implications and potential risks. Exactly. They also need to prioritize data quality,
Okay.
which is crucial for any AI system.
Right.
You know, if you're training an algorithm on biased or incomplete data, you're going to get biased or inaccurate results.
Garbage in, garbage out.
Precisely. Health plans need to be extra vigilant about ensuring that the data feeding their AI systems is accurate, representative, and free from bias. This is especially important given the potential for AI to exacerbate existing health disparities,
Right.
if not implemented thoughtfully.
So it's not just about efficiency, it's about fairness.
Absolutely.
What else is on the checklist for responsible AI use?
Transparency is key.
Okay.
Health plans need to be upfront with consumers about how they're using AI, what data they're collecting, and how it's being used to improve care. This transparency can go a long way in building trust and alleviating concerns about privacy and autonomy.
It's about giving people the information they need to make informed decisions about their own healthcare.
Absolutely. And finally, the report encourages health plans to think beyond current applications
Okay.
and explore new and innovative ways to use AI.
Okay.
This could include things like improving administrative processes,
Well-
enhancing patient engagement, or even developing personalized treatment plans.
So it's about seeing AI not just as a cost-cutting tool, but also as a way to
Right.
improve the overall quality of care.
Exactly. AI has the potential to revolutionize healthcare, but it's up to us to ensure that it's used responsibly and ethically, always with the patient's best interest in mind.
Now, zooming out a bit,
hmm
what are some of the overarching themes or takeaways that our listeners should keep in mind as they think about the future of healthcare?
Despite all the challenges and uncertainties, there's a strong sense of optimism running through the Deloitte report. Healthcare leaders are excited about the possibilities, and they see a path forward for an industry that's been under immense pressure.
It's like they're finally seeing the light at the end of the tunnel.
And that light is powered by innovation, a renewed focus on the consumer, and a willingness to adapt and evolve. The healthcare landscape is changing rapidly, and organizations that can embrace this change will be the ones that thrive.
So to recap, what are the key strategies for success in 2025 and beyond?
The report highlights three essential strategies.
Okay.
First, execute a multidimensional growth strategy.
Okay.
Don't rely on one-size-fits-all solutions.
Right.
Instead, tailor your offerings to the unique needs and preferences of different consumer groups.
It's about being nimble and responsive, understanding that what works for one person may not work for another.
Second, prioritize meeting the needs of all consumers. This means ensuring that healthcare is affordable, accessible, convenient, and equitable for everyone. It's about putting the consumer at the center of every decision and creating a more human-centered healthcare system.
It's about remembering that healthcare is ultimately about people, not just profits.
And finally, organizations need to remain resilient, innovative, and responsive. They need to be prepared for the unexpected, embrace new ideas, and constantly seek ways to improve and evolve.
It's about being adaptable, forward-thinking, and always learning.
Exactly. The healthcare industry is never static, and the organizations that can embrace this dynamic nature will be the ones that shape the future of healthcare.
Well, that's a lot to think about. We've covered a lot of ground in this deep dive, from growth strategies and affordability initiatives to the evolving political landscape and the responsible use of AI.
And we've only just scratched the surface. This report is packed with insights and recommendations, and I encourage our listeners to explore it further and draw their own conclusions.
Absolutely.
Yeah.
We hope this deep dive has equipped you with the knowledge and insights you need to navigate the ever-changing world of healthcare.
And as we head into 2025, remember that healthcare is ultimately a collaborative effort. It's about patients, providers, policymakers, and innovators all working together to create a system that works for everyone.
So let's keep the conversation going. What are your thoughts on the future of healthcare? What innovative strategies do you think will be most successful in reshaping the healthcare landscape?
Share your ideas with us on social media or send us an email. We'd love to hear from you.
Thanks for joining us on this deep dive. Until next time, stay curious and keep learning.